All right, welcome back to the channel. Let's talk in 3 minutes or less about the hydrochlorothiazide and prevention of kidney stone recurrence, aka NOSTONE trial. My name is Mike Freilich, general internist and clinician scientist. So here's the framework that I use when thinking first about the study design. I use a PICOT framework. So what was the population? Patients with recurrent kidney stones. Intervention, hydrochlorothiazide, that's a pill at 3 different doses. Comparator was placebo. The outcome was a risk of recurrence of a kidney stone, and the median follow-up just under 3 years. And now when I think about sort of the quality of the study, I use the PHOBIA mnemonic. So P, was it placebo-controlled? Yes. How is it funded? A combination of government and academia. Was the outcome clinically relevant? Yes. Was it blinded? Yes. Intention to treat? Yes. And was it a lot of centers, right? Multi-center studies, yes. So very high quality study. In terms of the results, so they screened nearly 1,400 patients, 416 were randomized. Loss to follow-up was about 7%, maybe a bit higher than what we might like. Baseline characteristics, average age 49, 20% female. In terms of prior stones, most individuals had 2 or 3, and then a third had more than 3. Here's the Kaplan-Meier curve. So what on earth does this show us? It shows that all of these lines overlap. All right, and the rate ratio or the risk of stones was identical in these 3 groups, regardless of whether or not you got placebo, low dose hydrochlorothiazide, usual dose hydrochlorothiazide, or high dose hydrochlorothiazide. In terms of secondary outcomes, there might have been a small signal that patients who were on the very highest dose of hydrochlorothiazide had the lowest risk of symptomatic recurrence, but we got to be very careful fishing for secondary outcomes. There did appear to be an increased risk of adverse events for the group that got hydrochlorothiazide compared to placebo. In terms of limitations of this study, the biggest limitation, it's relatively small, and also lack of generalizability. Vast majority of patients were men and Caucasian. And then there was a high incidence of non-adherence, and that can bias towards a null finding. Take-home point, recurrence of kidney stones in patients at high risk of recurrence did not differ when treated with hydrochlorothiazide versus placebo. This is incredibly informative to me as a practicing physician because we were always taught that hydrochlorothiazide would help. Whoops, doesn't seem like it. Thank you very much to Natasha Verhoef for producing this video. Have a great day.